welcome back to USA Global TV, home of Talking Heads, and a big shout out to our friends listening on Business Talk Radio out of New York. I'm Dr. Jacalyn Kerbeck, and we are thrilled to have you here today for a very special event. My guest is going to be joining us from Pittsburgh today. We're talking about an issue that is really worldwide. It affects so many people, and we need to gather together, work together to help eliminate cervical cancer. My guest, her name is Colligan. I want to bring her out. She is just a beautiful light in this world, and I'm so happy that she's able to be here. Hi, Kate. Nice to see you.
Hi, Dr. Jackson. Good to see you, too. Thank you for having me.
It's my pleasure. Kate is the Director of Development and Communications for Basic Health International. Kate, why is this initiative so important to you?
When I learned about it, this was not something I initially knew about at all. I thought cervical cancer was something that was largely under control, and it is in places like the United States. However, I met colleagues at Basic Health International a couple of years ago and found out that the entire reason Basic Health International formed was to get help to women in the poorest and most vulnerable countries on earth. Those women are still getting cervical cancer, something that we here in the United States usually prevent through vaccine for HPV, and we don't see as many cases. But over 340,000 women are dying a year of a disease that's completely preventable. So what really attracted me to that is that to this cause is that this is really about health equity and health equity for women. These are women who are dying in their mid-30s to mid-40s in the prime of their life, leaving small children. And I think we can all really identify with that. You know, if you had been able to have that shot that we give, the HPV shot that we give our children at age 11, 12, and 13, that wouldn't even happen to them. So the greatest thing about working in cervical cancer with this group is I work with a team of medical researchers who are actively making the tools that need to be used in these areas of the world, making them affordable, but bringing them the best possible technology to make them equal with the rest of the world in being able to defeat this cancer.
Well, I have to applaud that. That's outstanding to you and to everyone at Basic Health International. I'm wondering, Kate, in your role as Director of Development and Communications, what responsibilities do you have in that area, those areas, you say?
Well, all of our outward communication and all of our fundraising. But all of our fundraising and marketing. So I am extremely thankful for the content we're able to have through your platform today.
Well, fundraising is so important. I do a lot of fundraising myself for the Crohn's Colitis Foundation, and I don't think people realize how much difference $1 can make if each person donates $1 and it all adds together. But Kate, what I found is, and I'd love your thoughts on this, people will say, I feel embarrassed, like $1, they're going to see my name somewhere and they're like, oh, she only gave $1. What are your thoughts about getting involved in any way possible that a person can financially?
Yeah, I commend you for the Crohn's Colitis Foundation. They're doing wonderful work, and I've been to several events, and I think that's another area, where we think of there's a potential stigma. Just as there is with cervical cancer because of HPV being a sexually transmitted disease, and even using the word cervix, which we use over and over again. And you can imagine what Facebook does to us using some of this terminology for the body. But what can $1 do? I can tell you, and this is where I've really, I think, been able to communicate with women's groups and other groups. $100 would provide 20 cervical cancer screenings. $10 would provide a woman with the amount of cervical cancer screening she needs for a lifetime. So that's a really big deal. So every dollar counts.
That's huge. Wow, those numbers are impressive. So something else that I've heard in my fundraising is, how do we know the money really goes there to research? Like, how do we know that the potential patient actually gets the funding. So what do you have to say about that?
Right. I think that's absolutely has to be very on top of the list for every nonprofit organization is, what is the impact and how are we transparent about it? So for instance, some of that money is going to go to some of the money that will assist in screening. It may not be the actual screening. It might have to go to the transportation for that woman to get to her screening. It might go to the meals that she needs because this clinic may be further away from her. It could go to the other costs, such as childcare costs, those wraparound things that we don't think about just in science. So we're doing science, but we're really respecting the whole individual and making sure that the follow-up care and everything is taken care of. And this takes a tremendous amount of cooperation, even beyond donations. This takes cooperation with other NGOs, with ministries of health, with governments, and other care workers.
That's a great point, Kate. Actually, I was going to ask you about that. So, here in the United States, if you are pro-vaccinations, right, and you decide to get a vaccination, it's a process that's identifiable. Do this, go here, get that. But outside the United States, it might be a completely different process in every country. So it sounds like that Basic Health International, that your headquarters there in Pittsburgh, you're aligned with organizations around the world that can help facilitate this knowledge and this distribution process.
Yes, I mean, we work alongside and with many organizations because this is a big problem, and it's not going to. All of us have to come together in order to solve it. And we know that there are social issues with it. There are many barriers to women getting the services they need. As you pointed out briefly, if we go back to the 1950s, there were a lot of deaths in the United States still for women from cervical cancer. It's not something that's brought up in a whole lot, but these were, suffered in silence type deaths. And we've been able to prevent that. It's been astounding the way testing is going, the ability since 2006 to have an HPV vaccine that just prevents this from becoming a disease in most cases. So what a woman might experience in what we call low middle income countries, a low middle income country for many people who haven't heard of that, is these are poor countries that may have somewhat of a healthcare system, but it's not entirely accessible in the way that it would be here in the United States. It may also be an area that's quite remote, that doesn't have electricity all the time or intermittently, may not have a pure water source at all times. So our research and our work are for areas like that. If you could imagine being in a jungle and bringing in tools such as a big cryo tank, trying to drag that through the jungle, how is that going to work long term? How are the people that we're training for these clinics, how are they going to be able to manage the tools and the resources to get them to screening and treating women? And so a lot of this is very practical. How can we make things small enough, easy to handle, but extremely effective? How do we give these tools and train people within that country to use the tools and make this a really sustainable enterprise within the country itself? And that has to do with the cooperation of governments, cooperation of communities, and cooperation of donors. And, it's really a vast improvement.
I appreciate you sharing all of that because I think sometimes we take for granted the healthcare, the access to healthcare that we have in some parts of the world, that it's just an oversight almost. Whereas in other places, you just talked about dragging huge equipment into a jungle. I mean, we're so lucky in so many ways. So, Kate, I'd like to take a step back just for anyone who might not understand about the screening, and correct me if I'm wrong, but as women, we can go and have a pap smear, And then we wait for the results. And of course, that those days, that week that we're waiting, at least for me, is very nerve wracking, because you're like, please let it be negative, because if it's not, your whole life is going to change. But these tests, this screening isn't available readily everywhere in the world. That's what we're talking about, correct?
Somewhat correct.
Okay.
So I'll take it from there. So
Okay,
yes,
good.
absolutely. So absolutely, like here in the United States, we're used to this. Every year you go do the uncomfortable thing, go to the doctor, stirrups, Pap smear. What's standard in the United States now is not only the Pap smear, but also getting an HPV test. And what's happening in these other countries, they don't have pathology labs as readily available, and Pap smears themselves, to be able to store them in a stable place until they can get to a pathologist, it might ruin the cells, and they wouldn't be able to give you an accurate reading. What some of our research and the research of others has found is that doing an HPV test is a far better indicator of whether cervical cancer will become, or cervical precancer, that you would be predisposed to have it. And then you can track that patient and you can offer them services and be able to prevent the disease entirely.
Thank you so much for sharing that. So I just learned something myself, and I'm a woman. What do you think about that?
Hey, do you want to learn one more cool thing? And it's
Yes,
happening
do
in other
tell.
countries. So you remember I said stirrups, and
Yes.
kind of, we don't look forward to it, but we know that it's our responsibilities for our families and for other loved ones, and just for the love of ourselves, that we know we have to go do that for ourselves. We have to make sure that we stay healthy. So how could we even make that easier? How about self-collected HPV tests? So that's, you don't necessarily have to go to the doctor's office. You get a little swab, and you could do that in the privacy of your own home. Read the directions, do it properly, put it in the enclosure that they ask you to, and drop off at the doctor's office or the clinic or wherever it's supposed to go, and then get rapid results. So
Wow,
that's
Christmas just came
yeah.
early. How about that
Uh-huh.
information? I love it.
And that's really something that we're working with in these countries, and to make it, like, how can we make it so accessible to women? How can we reach special populations? Think about transgender men, going into a clinic or going into somewhere, or thinking of a woman who has 4 or 5 children and can't find childcare for all of them, so she can go, do that. This also, from a public health perspective, it allows, especially during COVID, you only need to go to the clinic if it's positive, because then we can intervene. If it's not positive, you get a call or you find out on an app or whatever it is that, hey, you're good for this year. And wouldn't that be a relief? Because as you were saying,
Yes.
this feeling that you're waiting, you're not knowing, at least we can have the comfort that we have treatments available, and that there are all kinds of online support groups, and there is so much great work going on. But we are also pretty well informed here in the United States of, take care of yourself, get breast cancer screening, get cervical cancer screening, and listen to your doctor. So
All valid points. Thank you, Kate. We're going to take a break, and then we'll be right back with more conversation and discussion. So, our break today, I'm going to play a music video from one of our guests. Her name is Sam Sarah. She is in the UK, and the name of her song that she actually wrote and produced this video, it is Nothing Is Wrong with Me. Stay with us. We'll be right back with Kate Colligan after this break.
My stomach issues make me want to stay home, but that's not an option. No matter how prepared I am, I still feel nervous. Enough is enough.
If this sounds familiar, the Crohn's and Colitis Foundation can offer you support and connect you with a specialist.
Don't keep your symptoms to yourself. Get help at spillyourguts.org today.
Hello and welcome back to USA Global TV, home of talking heads, and welcome back to our friends listening on Business Talk Radio. I'm Dr. Jacalyn Kerbeck, and my guest today is Kate Colligan from Basic Health International. We're talking today to help elevate our knowledge about how to eliminate cervical cancer by 2030. And Kate has been giving us some fantastic information that is new to me, and I'm sure new to many others. So thank you again, Kate, for being here.
Thank you for having me.
It's a big topic, and when we think about eliminating it, obviously that means there's a lot of funding that needs to be compiled together. So we need people to donate, and we are streaming something for people to donate. Tell us more about that.
Yeah, so we do, as we talked about a little bit earlier, we really do depend on, we have some research grants from National Institutes of Health and others for our scientific work. But in order to reach more women, so our scientific work does a wonderful job of, we're able to train in our methods. We're able to get staff, ready. And we have a side of our work that's called implementation. So that's actually where some screening is done. And we know that we can, past our research, we can use those same labs to get to more women. So your money would go towards screening more women, getting women to these screenings, making sure that they have the wraparound care that they need in order to get back to real life. And I would say that the music video just inspired my thoughts, as music just does, doesn't it? But in talking to our researchers, we're a women-led research team. We have all women leadership. We work with, we do have men that work with us that are also research consultants, but we're a women-led organization. And I've asked some of our lead reasserchers, why should you give to an international, how do I say this in the United States? Why is it important to give to an international cause? We know why it's important in cervical cancer, because we can easily say, $10, 2 screenings in a lifetime, you've saved a woman from this. She said, if you can save a life, why wouldn't you? And why does it matter where that life is? And that, I think, is the most impactful and powerful thing that we can really think about. If you can do something beyond yourself, which I think there are many people out there that, especially in Thanksgiving season and the upcoming Christmas and Hanukkah holidays and Kwanzaa and New Year's, we're looking to extend ourselves. We should also be looking, we're doing something locally. We should also be looking globally, because if the past, is it 2 years at this point? If the past, experience and current experience of COVID has taught us anything, it's that we're only as healthy as our neighbors. And who are our neighbors? If we know that a woman counterpart somewhere else in the world could use our help for as little as $10, it's worth doing.
Thank you, Kate. And I think it's important that we talk about cervical cancer. Nobody likes to talk about cancer, but cervical cancer could be a death sentence if you're diagnosed with it, correct?
Yes. I mean, at a late stage, where we find the difficulty is, where a woman hasn't been screened earlier on and doesn't have the results that a doctor could perform an intervention and make it go away. Many of the women that they were first seeing in some of these countries, were in later stages of very invasive cancer. And the other thing to think about is how they die in these circumstances. Oftentimes at home, we know that they don't have access to palliative care. So, we're even talking 15 years ago, aspirin, and you're literally bleeding to death. It's not a comfortable death. It's very painful. I don't know how many of your viewers have watched and listened to Evita, and there's chronicling of Eva Perón, going through this type of pain and trying to pretend it wasn't there, knowing that, it might end her life. She didn't want to address it, and it really ended up dominating her life, and it's still, the tale told of her death.
Mm. And I'm glad that you're here, as I mentioned before, to really bring light to this. And I love that you shared the fact that Basic Health International is a female-led organization. Mm-hmm. So I actually have never worked in an organization that was predominantly women. So what's that experience like for you, Kate?
Well, I don't think that I have either. And I get to be one of them. So
fantastic.
So it's wonderful. No, it's really great. Our founder and president, Dr. Miriam Kramer, who initially, had this idea, she met with women in a remote village in El Salvador, and that's what inspired her to start Basic Health International, to make sure that women, no matter where they live, have access to some very basic care that prevents their death. And I find Miriam very personally inspiring. I find our chief medical director, Dr. Rachel Mash, extremely inspiring. She had originally looked into becoming a diplomat and ended up becoming a physician and got her master's in public health. She's done tremendous work in Haiti. And those populations there, she's just very inspiring, and in both of them are such great mentors and teachers to others and in guiding. In El Salvador, we have Dr. Carla Alfaro, and she is again inspiring. In fact, she's the one who said, well, if you could save a life, wouldn't you? I mean, does it have to be next door to you? I mean, and that the reason that she goes to work, because if she could save at least one person, that's a lot. And lastly, we have Montserrat Soler, who is a PhD who really originally came out of anthropology. She's a research consultant for us, and can look at that holistic view of a woman, and also provide the research side of it, of what's happening, why is this happening. It's great. Our chief operating officer, Evelyn Mumenthaler, has for a long time worked in cancer and cancer foundations, cancer research foundations. So this is our whole research team. And last but not least, our CFO, Chief Financial Officer, Catherine Platt, who has been a tremendous support also. There's a lot of complicated things that happen in a research nonprofit whenever you're beginning the side that I'm on, which is looking for donations, looking to really have impactful and aligned relationships with donors. And she's been used to working with major grant organizations such as the NIH, and a lot of the complication of making sure the money gets to the right places for the right sites so that we can carry out our work.
It's really impressive. And Kate, I'm over here on your website, which is basichealth.org, O-R-G. And these numbers, for the impact for your organization. Over 144,000 women screened for cervical cancer. Also, over 15,000 women treated for cervical cancer, over 5,000 health professionals, and over 47 published medical and health policy papers. And this is a substantial organization, really making a lot of difference in the world. Places where you've worked: China, Colombia, Dominican Republic, El Salvador, Guatemala, Haiti, Malawi. Is that how you say that? Malawi? Malawi. Nigeria, Paraguay, and Peru. Truly incredible. And then real life stories from patients, providers, researchers, and staff. Please go over to basichealth.org. So those numbers are impressive.
Well, thank you. And they need to grow. And so that we can, all of the women that I talked about earlier, they're like, we want to put us out of a job, please. We can do this. I mean, this is a doable goal, this 2030. If we get enough women screened, we really have a chance to do this within our lifetime. And Basic Health International, as I said, they concentrate on the women who are in midlife who would have missed the vaccine. But we also are a huge proponent of course, please vaccinate the children so that we can make sure the next generation doesn't have this burden.
So let's talk a little bit about what we as humans and our audience, what we can do to help support this effort of eliminating cervical cancer by 2030. So the first thing we can do, and as you talked before about how important donations are, any amount is appreciated. There is a ticker going across, and we put it on social media. So please do donate. You can go right now. You can even put in the comments that you're donating. We would love to hear from you, whether we're on the live or you can do it after the show. Second thing is awareness, right? Awareness. And then getting children vaccinated. What are some of the other things that we can do to help support this initiative?
Yeah, I really think that it's in general supporting women, supporting the need for health, and making that a focus. Being very intentional and mindful of your giving practices. Can you make an effect in that way for women? And Basic Health International does. You can tell by the impact numbers, the research publications, obviously, and our relationships with partner organizations, particularly the WHO and many other organizations around the world as collaborators. Our goal is that no woman feels alone in this, that she has access to cervical cancer care and prevention.
Thank you, Kate. And I know before we actually met for the show that there's an anniversary, right? This is a 1-year anniversary. Would you want to share that with our audience, please?
Yeah. So last year on November 17th, it was the WHO kicked off its launch of worldwide cervical cancer elimination strategy. So what that means is that 194 countries joined with the WHO to say, hey, we are, for the first time ever in the world, going to get rid of one cancer. We can do it. It's achievable. The cancer is cervical cancer. So they want everyone to get behind it. And this, for some countries, to be able to build a cancer registry or to be able to do the screenings, they need a blueprint. They need, ways to help. And that's something that Basic Health International is doing right now, and works along with other colleagues with the WHO to provide technical guidance for countries to do that. It's not a moneymaker. It's purely why we do nonprofit research.
Thank you so much, Kate. We're going to take a short break, and when we come back, highlight you and have you give your contact information and anything else that you want people to be aware of. So during our break, we are actually going to take a look at another music video. Why? Because I'm in that kind of mood today. Our music video is by someone. Her name is ILO, ILO. And in this music video, you will also see Tony Moore. We're having Tony Moore on tomorrow for a special event. He is launching his latest track, Never Gonna Say Goodbye. But for now, we're going to take a look at ILO, and you'll see Tony on the keyboards. We'll be right back with this special event. Hello, everyone, and welcome back to USA Global TV, home of Talking Heads. And again, welcome to our friends listening on Business Talk Radio. Our topic today is eliminating cervical cancer by 2030. And my guest is kcolligan from Basic Health International. We've talked about a myriad of topics, the great work that you're doing there, that your female-run organization is doing. We haven't talked about how COVID has impacted cervical cancer screenings, how it's impacted the work that you're doing. So I'd love to hear more about that, Kate.
Yeah, I think that we all know that it has impacted cervical cancer screenings in general. People have been reticent about going for their screenings in the U.S., abroad, and certainly in the countries where we work. So that's a takeaway for from that is please go get your screenings. Encourage your loved ones to get their screenings this year. Don't wait. Make sure that you go in and get them. So COVID, how did COVID affect us? As soon as it began, parts of our organization had to really shut down parts of studies that were going on, but we were able to, because we're small, we were able to take advantage of an opportunity that came our way. We had just finished working on a very high performance HPV, validating a high performance HPV test for use in low income countries on a particular platform. And we did this work alongside some bioengineers. And this group reached out to our director and said, hey, we think we're going to use the same platform for COVID. Would you be interested in validating our work? So we got right into the COVID game. So that's really exciting. Now everybody knows what a PCR machine is, right? Which test did you get? The PCR test or this or that, And so what is exciting about that for us is that it's allowing us to begin to build some infrastructures in countries that never had, a basic lab infrastructure, so that we can do this important COVID validation. At the same time, because it's a virus, we can switch as COVID becomes less of a concern. We can switch those labs over to HPV. So that's a really exciting to be able to go back and forth between those and serve more communities in general, and giving them the assurance that they have some control over their public health.
Wow, that is fascinating. I just love technology. I'm a huge fan of technology, all the advancements that enable us to take care of our health. And as you mentioned, please go get your screenings, encourage other people. I know I was reticent. I didn't go to the doctor for over a year. I didn't get any tests, but I've slowly been getting all of them because it's really important. Kate, we have come to the end of our show, which I've had so much fun, by the way, having you here and this really important topic. I'd love to have you back. If you could share with our audience, who should contact you and how can they reach you and get involved?
Right. I would love to hear from people who might be interested in donating or are just interested in knowing more about this topic. We are looking for friends. We're fundraising and we're fundraising. If you feel that this topic is important to you, I'd love for you to reach out. I have my email address below. It's kcolligan at basichealth.org. You can also go to our website, which is below, www.basichealth.org. And love to hear from you. That would be great. We have a place to sign up for a newsletter right on our website, and you can follow us on social media. We would love to hear from you and love to have you involved, be part of our community. And to Dr. Jacalyn, thank you very much for having me. I would love to come back. And I'd like to point out that January is Cervical Cancer Awareness Month. So if we are looking for dates, maybe January.
Fantastic. I would love to have you back in January. And also, if you have a public service announcement, we'd be happy to run it on the show. So,
oh, fantastic. I appreciate it.
Yes, wonderful.
Great.
All right. We'll look forward to having you back in January. Thank you again for being here.
Thank you so much. This is a great way to build relationships.
Absolutely. Remember to go over to USA Global TV and subscribe. If you're just joining us now, you'll be able to find this show under special events. We'll put it there by the end of the week. So it's actually there now, but not under the playlist. So, all right. Thanks again, Kate. We'll look forward to seeing you in January. Bye-bye. So much important information, and we have to take care of ourselves, and we have to encourage others to do the same. I know sometimes we want to put blinders on and just say, I don't want to deal with it. I'm not going to worry about it, but we have to take care of ourselves. And as Kate also mentions, why not help people around the world? Why does somebody have to be right here? Our platform is a global platform, and I'm all about supporting people, having them share their stories. So let's support each other and support world health. Really, I really am an advocate for that as well. Please to reach out to Kate. Again, if you missed any of the show, if you missed the place that you can find to donate, it's in the comments section on social media, and you can also find it over on our YouTube channel. We have 2 shows coming up. The next one's coming up in less than 10 minutes. It's the Business Talk Show with my co-host Alcini. So we will see you shortly. After that, we have the Listening Mentor, and my guest is elevated listener Hyatt Ives. So we'll be thrilled to share listening tips that help facilitate inner and world peace. Thanks again. Bye, Kate.